So someone wanted to know about Raeder, paratrigeminal neuralgia. And as you can imagine, this is a very controversial topic. And the reason it's controversial is Dr. Raeder practiced in 1918. And that means you have no CT, no MRI. And so anything that Dr. Raeder wrote about this condition is subject to controversy because a lot of people who have this syndrome actually have a tumor. Paratrigeminal means it's next to the trigeminal. And so they're going to have trigeminal-based pain in their face, plus the oculosympathetic pathway abnormality, the Horner syndrome. So this combination of findings localizes, if it's V1 or V2, to the cavernous sinus. However, if it's the entire trigeminal, then you're going to be in the skull base or the brainstem. So you can see how this has to be a diagnosis of exclusion, and you need to have an MRI. In the 1960s, other physicians like Dr. Bonyak here in Houston tried to subdivide the Raeders into different groups, benign forms, group 2, and malignant forms, but 1960s, no CAT scan, no MRI. And then in the post-imaging era, Dr. Thompson at Iowa. Now you're starting to get into the imaging era, and that's going to be the classification again. So all of these classifications say this combination of findings could be bad or it could be benign. You need an MRI localized to the ipsilateral cavernous sinus, skull base, and brainstem whenever you have a paratrigeminal facial pain plus the oculosympathetic. And so for me, I don't like this diagnosis because it implies that this is a separate entity, when in reality this is just a finding, a combination of paratrigeminal pain plus a Horner syndrome. You need to image it and look for a cause, and idiopathic is what we would call this now. The eponym gives you a false impression that we know what it is when we don't. So somehow idiopathic became Raeder. And it's the same with Bell's palsy. It sounds better to say Bell's palsy, but really what you said was idiopathic. It sounds better to say Tolosa Hunt, but really what you said was idiopathic, painful, steroid-responsive cavernous sinus ophthalmoplegia. And so to me, the danger of these eponyms is it turns the word idiopathic into someone's name, and that makes you get a false sense of security. So Raeder's paratrigeminal neuralgia, the combination of trigeminal facial pain plus Horner's, if it's no cause, idiopathic, we used to call that Raeder, and you have to decide for yourself whether you want to use the eponym or abandon it.